Very good morning. I am Dr. SANTHOSH Kumar, consultant neurologist at Koshys Hospital, Ramamurthy, Nagar. Today we are going to talk something about epilepsy. What is epilepsy? It's a condition which causes recurrent fits or recurrent seizures. Now, what is a fit? A fit is a condition wherein a condition of the brain wherein person suddenly becomes unconscious, he falls to the ground, and there will be tonic-clonic movements of the hands and legs with or without frothing in the mouth and with or without gallbladder incontinence. This is the most common type of fits we normally experiences, and people who have these fits again and again are called epileptic. Epilepsy is the most common disorder. Almost about 1% of the population in the world suffer from epilepsy. And whenever we diagnose epilepsy to a new patient, it is as if we have told them that they have a very serious disease to them. So the first thing that the patient should understand is that it is a very common disorder, just like your diabetes or hypertension, and that most of the people who we have diagnosed as epilepsy are leading a normal life with proper precautions and proper adherence to medications. Now, there are different types of epilepsies which the patient need not know all these things, but better is to speak to your doctor and understand what type of epilepsy you have. Are you having a generalized tonic-clonic type of seizures? Because the management, the type of drugs we use and the duration of treatment will vary. There is another type of epilepsy called as a complex partial seizure. And then there are very simple sort of fits like absence seizures or myoclonic seizures or simple partial seizures which patients sometimes are not aware of. Like for example, absence epilepsy usually happens in children between 5 to 15 years of age, and these are all very brief events lasting for about 10 to 15 seconds, wherein the patient partially loses the awareness and there will be some sort of fluttering of the eyelids, blinking, not responding, lasts for about 15 seconds to 20 seconds, and then the patient becomes perfectly alright. So unless eyewitness really carefully sees these things, you won't be able to know that this child is undergoing epilepsy. So once we know that we have an epilepsy, what to do? So the main important thing is follow up with your doctor. Once you have a diabetes, once you have hypertension, you go follow up with your physician. Same thing, once you have an epilepsy is diagnosed, please follow up with your consultant regularly. Now, ask your doctor what type of epilepsy is there and set a target for how long you may have to take these medications. Now, there are different sort of medications, the primary drugs and the secondary line of drugs, and patient can be controlled with very simple anti-epileptics, one drug, or sometimes few people require 2 drugs or 3 drugs, and very few patients, selected few of patients may require surgery for treating epilepsy also. So some do's and don'ts about epilepsy. Whenever a person has got epileptic seizure, please don't get panicky. Put the patient in either left lateral or right lateral position rather than in a supine position. Don't put anything into his mouth, either spoon or try to put your hand to prevent him from biting his tongue. Don't try to restrain the patient when he is violently convulsing, because there are chances that it may cause injuries and fractures. This fits usually will last for about 2 minutes or 3 minutes. After that, the person is going into a post-ictal state. After that, you wipe out the frothing from the mouth and put him in a safer place, and later on consult your doctor, because the chances of getting next fits in the next 24 hours after the first fit is very, very high. So these are some of the do's about epilepsy. Epileptic patients should take their medications regularly. They are not like other type of drugs wherein you take few days and then you miss a few days, because even if you miss a single dose, there are chances that epilepsy will be precipitated again. So take your medication regularly. Have regular hours of sleep, because sleeplessness can cause fits to happen. Don't fast. Have regular meal times and keep away from your stress and involve yourself in good physical activity. Now, there are some stigma associated with epilepsy, and people should know that this is a biological disorder like any other disease like thyroid or your diabetes, and there is no need to have some sort of stigma, that is your karma, your past, and that you have done something bad in a previous life, that's why you are suffering from these things. And epilepsy is certainly not contagious, it's not going to spread from person to person, and with good medications it can be fully under control. And if you people have any problem or any doubt with respect to epilepsy, you can get back to me at Koshys Hospital website, and I shall be responding to you at the earliest. Thank you. Merry Christmas.